Hey everyone, and welcome to The Explainer. I am so glad you're here today because we're diving into something really important. Our mission right now, to completely demystify, unpack, and distinguish the big three eating disorders you hear about all the time in the medical world: anorexia nervosa, bulimia nervosa, and binge eating disorder, or BED. We're going to look closely at the actual clinical realities behind these conditions, cut through all the noise, and give you a super clear, structured understanding of how they work and how they differ from one another.
But before we get into the nitty-gritty specifics, we gotta challenge a really common assumption. So what exactly defines an eating disorder? It's actually super easy to fall into the trap of thinking these conditions are just, modern lifestyle fads, extreme dieting gone wrong, or just wanting to look a certain way. But no, the reality is way more severe than that. These are highly complex, deeply serious psychiatric conditions. They are rooted in psychological distress, genetics, and neurobiology, and they have profound and sometimes literally life-threatening physical consequences.
And to prove that this isn't just some byproduct of social media or modern fashion magazines, take a look at this. These disorders actually have incredibly deep historical roots. I mean, we're talking way back to the 1870s. 19th century clinical pioneers, like the English Dr. William Gall and the French physician Ernest Charles Lassagne, were basically describing what we now call anorexia nervosa at almost the exact same time. Long before televisions or the internet even existed, this profound, obsessional fear of weight gain was already being documented by the medical community. Okay, so here's our game plan for today's explainer. First, unpacking eating disorders. Then we'll cover anorexia nervosa, bulimia nervosa, and binge eating disorder, before comparing the big three, and finally, exploring pathways to treatment.
All right, part one, unpacking eating disorders, screening and definitions. Let's quickly look at how clinicians actually identify these super complex issues in the real world.
To do this, medical pros often rely on something called the SCOFF questionnaire. It's a highly effective, validated screening tool, and the acronym is actually really clever. Check it out, SCOFF. Do you make yourself sick because you feel uncomfortably full? Do you worry you've lost control over how much you eat? Have you lost 1 stone, which is about 6 kilos or 14 pounds, in just a 3-month period? Do you believe you're fat when others say you're thin? And does food absolutely dominate your life? Answering yes here really highlights how this isn't just about food itself. It's fundamentally rooted in psychological distress, a totally skewed self-perception, and a massive loss of control. And speaking of that loss of control, that brings us to a definition we absolutely have to lock down before moving on: the binge. Clinically speaking, a binge means eating a reasonably large quantity of food in a specific, discrete period of time, usually under 2 hours. But here's the key. It's accompanied by a profound sense of totally losing control over eating during that episode. That specific feeling, like you literally cannot stop yourself, is the crucial pivot point we're going to use today to differentiate these disorders. So keep that in the back of your mind. Moving right along to part 2, understanding anorexia nervosa, the drive for thinness. Let's dig into this obsessive and really dangerous drive to lose weight. So, looking at the official diagnostic guidelines, anorexia involves heavily restricted eating that leads to a significantly low body weight. Or, if we're talking about kids and teens, faltering growth and basically failing to gain expected weight. But the physical restriction, that's driven by intense psychological symptoms. We're talking about a completely paralyzing fear of gaining weight and a really severe disturbance in how a person evaluates their own body shape. It's like they look in the mirror and see someone totally different than what the rest of the world sees. It's a tragic paradox of body image distortion, and it's what makes anorexia one of the absolute most lethal psychiatric conditions out there. Just take a look at the sudden drop-off on this pediatric growth chart. It's wild. Normally, a developing body is supposed to follow a steady, upward curve for both height and weight, right? But look at how the onset of the illness and the starvation that follows literally hits the brakes on a developing teenager's normal growth trajectory. The body basically just goes into survival mode and shuts down all non-essential functions, totally sacrificing height and long-term development. It's just a really stark visual of what this disorder physically does to you. All right, part 3, understanding bulimia nervosa, the cycle of distress. Unlike the continuous restriction we just saw with anorexia, bulimia is all about a highly distressing, repetitive cycle. Bulimia nervosa is defined by recurrent episodes of binge eating. And remember our definition from earlier? That means eating a large amount of food with that profound sense of losing control. But the defining feature of bulimia is actually what happens after the binge. To prevent weight gain, the person engages in recurrent, inappropriate compensatory behaviors. Basically, they try to undo it. This could be self-induced vomiting, misusing laxatives, fasting, or compulsive excessive exercise. For a formal diagnosis, these cycles have to happen at least once a week for 3 months. Oh, and here's a massive distinction you need to remember. Unlike anorexia, where patients are severely underweight, individuals battling bulimia are typically at a totally normal or even above normal body weight.
Next up, Part 4, Binge Eating Disorder, Loss of Control. This one is super prevalent, yet frequently misunderstood and often hidden away due to immense shame.
Check out the clinical criteria for BED. You'll notice right away it shares the recurrent binge eating component with bulimia. So episodes of eating rapidly, often alone because of sheer embarrassment, eating when not even physically hungry, and feeling overwhelming guilt or disgust afterward. It's incredibly distressing, but, and this is the absolute crucial point here, while BED involves that same profound loss of control, it completely lacks the regular compensatory behaviors we just saw with bulimia. So there's no purging, no extreme fasting, and no extreme exercise trying to cancel out the binge.
And wow, this number is just striking. Binge eating disorder has a lifetime prevalence of up to 2.6% in U.S. adults. To put that into perspective, while BED gets way less media attention than anorexia or bulimia, it's actually the most common eating disorder of the three, hands down. It can affect people across the entire weight spectrum, though in clinical samples it is strongly associated with being overweight or obese.
Which brings us perfectly to Part 5, comparing the big three, anorexia versus bulimia versus BED. Now that we've got the foundational pillars down, let's put them side by side and see how they actually stack up.
Okay, this matrix right here, it perfectly synthesizes everything we've talked about so far. Seriously, if you only remember one slide from this entire explainer, make it this one. Notice how weight status, the presence of binging, and the act of purging act as the exact boundary lines separating these conditions. Look at anorexia. It's always defined by low weight and intense body image concerns. But typically, there's no binging or purging. Now, there is a specific binge-purge subtype, but even then, the person's weight remains dangerously low. Then look at Bulimia Nervosa. They absolutely have body image concerns, they binge, and they purge, but their weight stays normal or above normal. And finally, binge eating disorder. The weight varies, they definitely binge, but they do not purge. It just perfectly maps out the whole diagnostic landscape in one shot.
And finally, Part 6, Pathways to Treatment, Evidence-Based Recovery. Let's look at how the medical world actually tackles these illnesses. Because yes, despite how entrenched these disorders get, recovery is 100% possible.
Even though these disorders look different on the surface, successfully managing them usually requires a highly tailored, multidisciplinary approach. Pretty much across the board, psychotherapy, specifically cognitive behavioral therapy, or CBT, is the absolute first-line treatment to help normalize eating behaviors and fix that distorted body image. For anorexia, physical and nutritional rehab is literally step 1, because you have to reverse the immediate life-threatening dangers of starvation. And then there's targeted medication. For example, SSRI antidepressants, like fluoxetine, are actually FDA approved to help reduce binging and purging in bulimia. And for moderate to severe BED, a medication called lisdexamfetamine is sometimes used to curb the frequency of those binges. So it's a very integrated, team-based approach.
And the data on this is just super encouraging. Take this quote drawn from major clinical reviews. It provides so much hope. It shows that structured psychological interventions like CBT lead to significant end-of-treatment remission rates for about half of patients. That's huge. Recovery isn't just some nice idea. It is backed by hard clinical data. With the right mix of therapy and medical support, patients really can and do get their lives back.
So I want to leave you all with one final thought to chew on. We know what these disorders look like, we know the brutal physical and psychological toll they take, and we know that evidence-based treatments actually work. But still, so many sufferers hide in total silence because of the shame. So, how can we, as a society, better support mental health awareness to catch these restrictive and binge cycles early? Think about it. Reducing the stigma, increasing early awareness, and understanding that these are real, complex illnesses, and definitely not choices, can quite literally save lives. Thank you so much for hanging out with me for this explainer. Keep learning, keep asking those big questions, and I'll catch you next time.